Evergreen resolution to lead a healthier lifestyle by the World Health Organization. Eat a combination of different foods, including fruit, vegetables, legumes, nuts, and whole grains. Adults should eat at least 5 portions or 400 grams of fruit and vegetables per day. You can improve your intake of fruits and vegetables by always including veggies in your meals, eating fresh fruit and vegetables as snacks, eating a variety of fruits and vegetables, and eating them in season. By eating healthy, you will reduce your risk of malnutrition and non-communicable diseases such as diabetes, heart disease, stroke, and cancer. Reduce your salt intake to 5 grams per day, equivalent to about 1 teaspoon. It's easier to do this by limiting the amount of salt, soy sauce, fish sauce, and other high-sodium condiments when preparing meals, removing salt, seasonings, and condiments from your meal table, avoiding salty snacks, and choosing low-sodium products. On the other hand, consuming excessive amounts of sugar increases the risk of tooth decay and unhealthy weight gain. In both adults and children, the intake of free sugars should be reduced. Who recommends consuming less than 5% of total energy intake for additional health benefits? You can reduce your sugar intake by limiting the consumption of sugary snacks, candies, and sugar-sweetened beverages. Fats consumed should be less than 30% of your total energy intake. This will help prevent unhealthy weight gain and non-communicable diseases. There are different types of fats, but unsaturated fats are preferable over saturated fats and trans fats. Who recommends reducing saturated fats to less than 10% of total energy intake, reducing trans fats to less than 1% of total energy intake, and replacing both saturated fats and trans fats with unsaturated fats? The preferable unsaturated fats are found in fish, avocado, and nuts, and in sunflower, soybean, canola, and olive oils. Saturated fats are found in fatty meat, butter, palm and coconut oil, cream, cheese, ghee, and lard. And trans fats are found in baked and fried foods and prepackaged snacks and foods, such as frozen pizza, cookies, biscuits, and cooking oils and spreads. Smoking tobacco causes non-communicable diseases such as lung disease, heart disease, and stroke. Tobacco kills not only the direct smokers, but even non-smokers through second-hand exposure. If you are currently a smoker, it's not too late to quit. Once you do, you will experience immediate and long-term health benefits. If you're not a smoker, that's great. Do not start smoking and fight for your right to breathe tobacco smoke-free air. Physical activity is defined as any bodily movement produced by skeletal muscles that requires energy expenditure. This includes exercise and activities undertaken while working, playing, carrying out household chores, traveling, and engaging in recreational pursuits. The amount of physical activity you need depends on your age group, but adults aged 18 to 64 years should do at least 150 minutes of moderate intensity physical activity throughout the week. Increase moderate intensity physical activity to 300 minutes per week for additional health benefits. Hypertension or high blood pressure is called a silent killer. This is because many people who have hypertension may not be aware of the problem, as it may not have any symptoms. If left uncontrolled, hypertension can lead to heart, brain, kidney, and other diseases. Have your blood pressure checked regularly by a health worker so you know your numbers. If your blood pressure is high, get advice of a health worker. This is vital in the prevention and control of hypertension. Road crashes claim over 1 million lives around the world and millions more are injured. Road traffic injuries are preventable through a variety of measures implemented by the government, such as strong legislation and enforcement, safer infrastructure and vehicle standards, and improved post-crash care. You yourself can also prevent road crashes by ensuring that you follow traffic laws, such as using the seatbelt for adults and child restraint for your kids, wearing a helmet when riding a motorcycle or bicycle, not drinking and driving, and not using your mobile phone while driving. Antibiotic resistance is one of the biggest public health threats in our generation. When antibiotics lose their power, bacterial infections become harder to treat, leading to higher medical costs, prolonged hospital stays, and increased mortality. Antibiotics are losing their power because of misuse and overuse in humans and animals. Make sure you only take antibiotics if prescribed by a qualified health professional. And once prescribed, complete the treatment days as instructed. Never share antibiotics. Hand hygiene is critical not only for health workers but for everyone. Clean hands can prevent the spread of infectious illnesses. You should hand wash using soap and water when your hands are visibly soiled, or hand rub using an alcohol-based product. Regular checkups can help find health problems before they start. Health professionals can help find and diagnose health issues early, when your chances for treatment and cure are better. Go to your nearest health facility to check out the health services, screenings and treatment that are accessible to you. A well-informed person is likely to live longer than an uninformed one and maintain a better quality of life. Reset health, reset life. Thanks for being with Channel Health and Alerts, keeping you updated on health parameters. Share to care.